I can't hear you.
All right, so I was muted. I'm so sorry. So, good morning, everybody who is in the northern, western hemisphere, I guess, and whoever is in Ethiopia, good evening. So, as it has been announced, today I will have my esteemed guest, Dr. Parker, with me, and we will have an interesting and engaging discussion about submitting rank order list, which is a very crucial step in your US residency application, I would say, because at the end of the day, what matters is how you submit and how you choose and how you rank your programs amongst those programs where you have interviewed over the past couple of months. So it's glad to have you back with me again, Dr. Parker, and I really appreciate your valuable time, for dedicating your time to sit with me and discuss this very important step of the whole ordeal. So thank you so much and welcome back.
All right. Well, it's my pleasure to be here. As you pointed out, every part in this application cycle sort of has its focus. And now this is really mostly what I'm hearing about and getting questions about is, can you advise me about my rank order list, and some questions that people continue sort of to be somewhat confused about. So I'm just here to provide guidance. I know many of you probably feel like you know all of this. Hopefully I can add some value during the course of this hour, but essentially it's sort of going over the basics and then maybe touching upon some things that you might not have thought of.
Yes, Dr. Parker. Actually, even for your clients who have been working with you, I'm sure maybe at different levels you might have raised this issue and discussed with them. But I believe it's a good golden opportunity for everybody, whether they have worked with you or not, to sit down for an hour or so and discuss this important part of the process. So, because it's very crucial, if you make the right choice, you go to right places. And if you make some steps, then you may mess up. And it's gonna be a marriage for 3 years at least, right? Depending on the specialty. So internal medicine, family medicine, at least 3 years, and other specialties up to 5 years and even more than that. So it's a big engagement, and you have to really be thoughtful in making a decision and finalizing your order list. So it's a big opportunity. Stay tuned. And those of you whom if you have friends who are in this process, please share the link and everything. So we will straightforward go ahead to the discussion, and I have a couple of questions for you, Dr. Parker. I've seen you have already shared a very beautiful, very comprehensive video about submitting a rank order list in your LinkedIn page. And those of you who have seen it and you still have questions, it's a good opportunity for you to raise those questions. Okay. So tell us about some of the essential points to know about this rank order list. What does it mean? In short, in abbreviation, they call it ROL, or rank order list. So what is rank order list? Why is it so important? And how do we craft it? Thank you.
So the rank order list is the list where you place an order where you would like to go for residency if you're given the chance to go next year. It really is a document or it's a process that is really based on what your decisions are in terms of where you want to go. It's really important that you remember a few things. Just for starters, I'm going to remind people that you have to be registered with the NRMP, that there's a separate registration for the NRMP that exists separate from the ARIS registration. There are certain deadlines that we can talk about that you really have to know about. And so there's some mechanical sort of logistics things that you need to know about the rank order list. And for people who are going through putting things in the rank order list, not sure how to do it, I would certainly recommend that you go to the NRMP website that has all the guidance that you need, step by step, showing you how to go about doing this. And it's really, all those kinds of instructions I think are worth your while, because you want to feel secure at the end of the day that you've done everything properly. So you need to be registered. You need to submit your rank order list. You need to put should only list those programs where you're willing to go. Now, I know that may sound sort of crazy, because most people who are IMGs are going to put everything, where every program that they've interviewed, on their list, but not necessarily. There may be programs that you had such a strong feeling, or you come to realize, we'll talk about more in doing your rank order list, that you really can't go to that program, and therefore don't put anything on your rank order list where you feel like you wouldn't be able to hold your commitment, because it's a binding commitment. Once you get a match, it's a binding commitment. I mean, it's very difficult to get out of, and it's only by the good grace of the program director that could ever happen. So those are the two things that I would say, or a couple things I would say at the outset. I would say that the most common question I get from individuals is, they're confused about the fact that they may have felt like they had a good interview at one program and a not so good interview at another program. And they almost uniformly feel that they should put the program where they felt like they had a good interview in the number one slots on their list. And while that may be true, if it's the place where you really want to go, that is probably the most common mistake that people make, is they rank things according to where they think they may be wanted, as opposed to where they want to go. Right? Because the match algorithm will always favor the applicant. So you should, if there's one thing, if you stop listening to this presentation, in the next 2 minutes, at least you'll have gotten the understanding that you should put the programs in the order of your preference, and forget about what happened on those interview days. Forget about post-interview communication where they may have said you were a delightful candidate or something like this. You really have to take all of that out of the equation.
I think that is a very valid point, because you never know. Sometimes you may have an impression that they didn't like you, but actually they liked you, because we have seen it in real life. For example, I remember from medical school, in oral examination, you think you are grilled, they don't like you, you didn't perform well. At the end of the day, when you see the grades, you have A++. But sometimes you have a very pleasant interviewer, you had a very nice stay with them, and you think you are getting A++, you are a C or a D sometimes, worse than that. So you never know. So sometimes people may be nice in general for every candidate, because actually they are trying to promote and convince everybody they are the best people on earth, So then they give you the impression that they like you, but actually they didn't like you, and they wouldn't be honest and tell you at face value that they didn't like you. So I think it's a very valid point. We don't have to really consider this kind of subjective thoughts and assumptions. Actually, it's an assumption, right? There is no proof in it. So I think it's a very valid point that you have reached. So applicants, you should think twice about where you really want to go, and make your rank order list crafted according to that decision, I guess. So that's a very beautiful point, Dr. Parker. So the next question I have is probably it may go with the first question. So what are the common mistakes or misconceptions which candidates might be committing in this process?
Well, I think that's the first one. The major one that people commit is that they they rank according to where they think the program, they like the program that likes them. And it's really kind of interesting now, because everything is virtual. You really don't get as much of a sense about programs. So I get it. Everything is based on whether or not you thought you had a nice interview, and if you had an open house, what people were like in that open house. You really don't get a chance to see the hospital and get to see people one-to-one. I do think that that's a disadvantage with the virtual format. mean, there's so many advantages to the virtual format in the sense that you can actually be interviewed, because otherwise you can't even get into this country and come and, you know, even if you could get here for those kinds of things, I mean, it would become, it used to be prohibitive, the cost. So there are many advantages with the virtual format, but I think one of the disadvantages is you really do, in a sense, have some less information than you otherwise would have when all the visits were in person. I mean, there are a few programs that are still doing in-person stuff, but they're really few and far between. So that would be the first thing I would say. You know, I think the second one is sort of that people don't recognize that the rank order list is really very personal. And it has to, and we're going to talk about that, I hope, really at some length, because there are many factors that go into it. And for certain individuals, there may be some factors like things related to their family, loved ones, and other considerations that actually weigh more heavily than some things that you might think are really important. Because in the end, it has to be a good fit for you, you know, and anybody else who you're bringing along. If I think it's going to be a good place for you to spend the next 3 years. So don't rely on what someone else feels about a program and what's right for them. It has to be what's right for you. And I know that I struggle with this sometimes when I try to counsel people, because I have my own impressions of places and my own thoughts about where I like to see people go. And I have to be very careful in certain ways not to advise them to, you know, do something that I just seems good for me, but really may not be the right thing for them. So that would be the other thing that I think is really understanding that this is a personalized process, and that once you've gone through it and you've made your decision and you've really thought through things, then you need to just leave it. You just need to leave it. You need to certify your list in advance of the certification date, not leaving things to the last minute because systems slow down. Sometimes there's problems. Get it done. Realize that you made the best decisions you could make, and then leave it to, you know, leave it to the match, to ensure where you're going to be. And then, of course, there's a lot of anxiety about whether you're going to match at that point. But I think you really have to do a very, you know, a very detailed calculus of things, and then let it go. Now, I've seen some people who create these spreadsheets and they give everything a score and they do it that way. I mean, I really, truly, I've seen this. It's quite incredible. And some people feel best doing it that way. And even though that's not the way I would do it, I do think that there's, you know, looking at every factor, there is some validity in doing it that way. But there's also just a sense of, this is the program that I feel is the best fit for me, my family, whatever. And then you leave it after you've done your evaluation.
I think that's a valid point, especially the one you raised about, you know, interviews being conducted virtually is a big disadvantage. In other ways, it has many merits with it, because, like, you know, I remember I traveled across 7 different states, and I had a couple of interviews in New York, so I had to go back and forth between New York a couple of times. But, you know, the bottom line is, you know, I was investing on hotel stays, and I had to purchase like flight tickets and food and everything. So there was a lot of cost associated with it that is avoided. But, like, you know, at the same time, I really value the fact that I had the opportunity to go to those places. Reason being, you know, there were hospitals which I didn't like just by looking at the amenity, the resident workstation, the on-call rooms, blah blah, and I have said, oh no, I don't want to come to this place because, like, you know, the amenity, I was not satisfied with it. There are some areas where I didn't like the city. I mean, like, oh my God, am I going to live here, like, you know, for 3 years? Hell no. There were places where I said that, even though, like, you know, I was scrambling and looking for opportunities, but I had to make, you know, choices at the end of the day. So these things, they seem minor, but they are really important. So I am sure there are many things which we need to consider, and I believe you are going to discuss and touch them one by one in detail. So before we do that, I want you to elaborate on one thing, And most people do have a misconception about how the algorithm works and what does it mean when we are talking about the algorithm would be favoring the applicant instead of the program. So what does it mean? How does it work? How does the algorithm favor the applicants over the institution? So if you can elaborate on this, I think it will clarify confusion from
Okay. So
some of
let's
the.
just take this most simple example. Let's say you have 2 programs on your list, okay? And each of those programs has 10 slots, okay? Each one has 10 slots. Program, hopefully I don't get this myself confused. Program A and program B, okay? You really want to go to program A and you put it number 1 on your rank order list. Okay, you put it number 1 on your rank order list. Program A likes you, but they don't put you in number 1, but they put you in the 10th slot. They put you in the 10th slot. And remember, they have 10 slots. Now, program B loved you, and they said, we're going to put you in number 1 slot. Okay, they're going to put you in the number 1 slot, but it's not your first slot. Okay, so which program are you going to end up with? Are the program that you put the number 1 slot and they placed you in the 10th slot, or the program that placed you in the first slot but you placed them in your second slot? It's the first one.
The first one, yes.
You're going to end up in the program that you put in the first slot, even if they placed you in the 10th slot. That's the easiest way for me to share that information. So, I mean, the tricky thing is you obviously don't know where anybody places you. You don't know how far they're going to have to go on their rank list to fill. And if you look at it in general, at least I know the internal medicine programs, most programs, if you look at them as a mix, they have to put somewhere between 8 and 10 people on their rank list to fill 1 slot. So hence, programs that have 30 residents, that's why they interview 400 people, because it's likely that they're going to go pretty high up on that rank list to get filled. So it's not like if you have a program of 30 that you're going to fill by number 30. If you fill by number 100, you're doing really well.
Okay.
Yeah. So just remember, it really, that's the best way that I can say it favors you. Now, there's one thing that I can't talk about because I really don't understand well how it works. And that is if you are, and I get very few of these every year, if you're matching as a couple, and how do you, there is a video on the NRMP about how the couples match works and how to look at that. And I would encourage, if there are any of you that are couples matching, that you look at that. That's a very difficult situation, especially if you have only each one of you a few programs. I'm not sure you can really game it to your advantage, but that would be the only thing that I would say is that still probably the same rules apply in a sense, but you probably have to make some decisions about which one of your number 1 choices is more important.
Yes, the couple matching is a little bit complicated, like you mentioned. Otherwise, it's just like you said, it favors you on top of the program, and obviously the programs will get what they want. But at the end of the day, if you don't like them, if you don't want them, you don't want them. They may put you number 1, but if you don't rank them, you don't rank them. If you rank somewhere else and they rank you well in the other program, you go to the second program than this one. So that's beautiful. I like it because so that everything plays out in terms of the decision made by the candidates and the programs.
Mm-hmm.
Programs eventually will end up filling their spots, but the applicants, they should get what they deserve, I guess, and what they want to get. So that's very beautiful. I think that will clear up confusion for most people. So I think we can proceed and you can discuss about, what are the things we need to consider in making the rank order list. Because for somebody who has 2 programs in the list, it's very easy. If you have only 1 single interview somewhere, that becomes automatically very super easy. Actually, you have 1, you rank that 1. That's it. Boom. But if you have 15, 20, 30 interviews, then the confusion comes there. And there are candidates where they apply for multiple specialties as well. I want you to address that one as well. For example, somebody may apply for general surgery and at the same time they may apply for internal medicine. So how do they do the rank order list? Which specialty first or what program? Because that matters. So the same principle, but to elaborate a little bit on that one as well. And then, let's go one by one, the things we need to consider when we are crafting the rank
Sure.
order list. Thank you, Dr. Parker.
Well, I think for people that are applying, and I have a lot of people who are applying in dual specialties, internal medicine, family medicine, neurology, internal medicine, some surgical fields where they sometimes have multiple. And I think, again, it's sort of the same thing. You have to look at where you want to go. You have to look at what specialty you want to. I mean, if you want to do surgery and you know it's more competitive, you can still put that down as number 1, 2, and 3 if you have, let's say, 3 surgery interviews followed by internal medicine. I mean, it's not gonna, if you don't get ranked, if you don't match with a surgery program, they'll just go down the list to the next thing. So it's not going to hurt you if you really want to do surgery and you put surgery first, even if you think it's a long shot. Put it down. I mean, that's what I would say to people. Put down where you want to be, in what specialty or in what city or whatever is important to you. Yeah.
I agree with you. I think that's a principle which needs to be followed. That also, holds true to institutions, right? Like, these big institutions, academic centers. If you interview there, put them number 1 if you really want to go there. Don't underestimate yourself and doubt yourself. Try your chance. If you get it, you get it. You don't, you don't. So let's go ahead and discuss about the rest of the stuff, which needs to be considered, Dr. Parker.
Okay. So one of the things I wanted to just, I find this actually quite interesting, that if you actually look at the NRMP data from 2024 and you look at it, that assesses what things did the applicants think were important, and this is applicants across program specialties and all applicant types. It's IMGs, US, non-US, DOs, MDs, it's all comers. And you look at what applicants thought were the most important things that helped them in the ranking, what were the most commonly identified items, and then what kind of weight did they give them. The first thing was overall goodness of fit. Goodness of fit, 81% of individuals said that was the number 1 consideration for them in the end. And out of a scale of 5, they graded that as a 4.7. So I want you to remember that, because to me, goodness of fit it's a compilation of things, right? I mean, it's not just one thing. It sort of suggests that they've looked at everything and they're trying to identify the goodness of fit for them. The next thing, which is surprising still to me, and I think is somewhat of a little bit of a problem in a sense, is that the second most commonly endorsed thing for ranking considerations was their interview day experience. So people are very swayed by their interview day experience, 80%, and they gave it, again, a 4.7 out of 5. So this is just your overall applicant when you take all comers. The next thing on their list was their desired location. So geography played a huge role for many people for obvious many reasons, which we can talk about. 76%, followed by the quality of the residents in the program, and then the work-life balance. It's interesting because the next thing in line was the reputation of the program, followed by the quality of the program director, the quality of the faculty, all things that I would say are sort of quality issues related to the program. But many people put things above that, which I find interesting, but not. But when you really, I think about it, it makes sense. So program, quality of faculty, balance of supervision and autonomy. We're going to talk about all these things, and sort of they end up looking at cost of living and future training opportunities at the institution and stuff like that. But goodness of fit, interview day experience, and geographic location were the top 3 things that applicants as a group felt were important. So maybe we could just then start, I can just start talking about each one of these, and I'll give sort of a pause, and then maybe if you want to ask questions, that would get us through this. I always think about it first as the program quality. That's the thing that I put on the top of my list, and that's probably why sometimes I get into conflicts with people about it, and I have to pull back, because to me, who your program director is, who the faculty are, if you have faculty that sort of have a breadth of experience, that you not only have strong core faculty, but you have subspecialty faculty, people who have some longevity in their teaching. I think those are the really beginnings of a good program. And if you don't have those things, I think it's very hard for the program probably to be particularly, to be really excellent. Faculty that are there for long term tend to be committed people who are interested in mentorship as well. So I think the quality of the program director, and how do you assess that? You can assess that by the length of, the length of their stay there, what their previous, if you can find it. And sometimes, it may not be available to you on the website, but you may be able to see them on LinkedIn or something else. You can get a sense of sort of what their academic history has been. Doesn't tell you whether they're a kind person or they're a malignant person, but you can certainly get things, I think, understood about their interest in education and their commitment to education. The second thing that to me still falls under program quality is sort of the academic commitment of the program to various parts of your education. So for a program to really be excellent, you have to have conferences. I mean, there have to be conferences available to you. There has to be board review. There has to be some kind of a morbidity and mortality conference, journal clubs. They can be all, sort of condensed into half a day, or they can be every day at noon or early in the morning. But, for medicine, if you don't have a strong morning report, I think you're already sort of in trouble in terms of that program having excellence. So in internal medicine, for sure, I look for, a strong morning report that you're going to be able to attend and contribute to, as well as core conferences, board review, journal club. Simulation training is, for many people is important. And I think it all depends on the specialty. Is it that important in internal medicine? Probably not. I mean, but for surgical training and other kinds of things like that, not having good sim center, I think becomes, is an issue. Emergency room medicine, they do a lot of stuff with simulation there. So again, just something to check off on a box saying, do they have some kind of simulation training or not? And does it seem like it's robust? Again, commitment on the part of the healthcare system. You're likely to find more of these at big university programs or programs where there's more resources to fund these sorts of things, because they tend to be expensive, but still just one thing on your list. And then scholarship and research. Asking programs, how do they support their residents in terms of scholarship and research, especially if you are considering any kind of fellowship, is really important. It's gotten to the point these days where for competitive fellowships, they want to see many, many publications. Whether you agree with that or you disagree with it, I tend to disagree with it, but whether you agree or disagree with it, you compromise yourself later on down the road if you don't go to an institution that supports you in terms of your research. And what do I mean by that? Has some research facilities or some people that are dedicated to helping you with your research, maybe has a dedicated research elective, has resources when you do publish that help you defray some of the costs. If you do get posters, do they send you to those institutions, or do they allow you to present? Do they give you the time off, and do they give you some financial support so that you can do those things? So those are the things that I would say fall into the quality of the program in terms of faculty, in terms of resource. the program structure is not so much quality, but I think, the kinds of rotations that you have, how they're structured, for some people that becomes very important, the structure of the rotations, and whether you have these 4+2 arrangements and all sorts of other arrangements that they have. If there's a dedicated night float, whether you're going to have night call duties or not, what that looks like, what kinds of electives you can take, how many you can take. And I think for some people, especially if you're in community programs, looking at whether or not the program actually allows you to go to an outside university, let's say, program to do an elective can become very important if you're trying to make a bid for fellowship. And realize that every time you go away from a program, they actually lose money on you. Some of the money that comes to you will then, the other hospitals usually will claim it in their cost centers. So they're not going to let you do that in excess, but not allowing you to do it at all is a problem if you want to do a fellowship and they don't have those rotations there, and you simply handicap yourself to some extent. And then I think under program structure is this whole concept of graded autonomy and supervision. You want to be supervised, but you want to have enough autonomy. That's a very hard thing, I think, for people to assess, and probably that's really best understood by speaking to the residents. Realize that, when you have programs at academic teaching institutions, large universities, some of your autonomy may be lessened by the fact that you're going to have fellows, you're going to have a whole hierarchy of individuals there, and so you may have less autonomy. Sometimes the beauty of small community programs is that you behave not only as a resident, but you also take on duties that are quite similar to fellowship as you advance in your second and third years when you do electives, because there is no one else. You're working one-to-one with the attending. So that can actually be a wonderful thing in terms of your autonomy and your learning. So I think these are things that you should consider when you're checking off the boxes and trying to really look at the quality of the program. Any questions on that, for instance, before I move on?
The only thing I would like to add is the only challenge is that, especially for IMGs who haven't got the chance to rotate through the US healthcare system, it may be very difficult to understand what you just said, because what is 4+2 night float, blah, blah, because if you ask me, when I came from Ethiopia as a resident, I worked 36 hours and then you continue the next day. There is no off day, there is nothing, So if you are on call, you are on call. So it may be, if you are on call over the weekend, it's going to be 24 hours. If you are on call during the weekdays, then you end up working 36 hours and you don't get paid. There is no day off after 24 hours, 28 hours. ACGME has multiple rules. Maybe they will understand it better after they join the residency, because most people are overseas. They have no idea how the US system functions. But for those people who are really mindful and who take serious note about the arrangements and everything, and the programs also offer, right? They give you the information about how first year is going to be, how the second year schedule looks like, and how the third year schedule looks like, how many electives and things like that. The policy will be communicated. So if you pay attention to that one and you understand it, it's a good point, like Dr. Parker said, because it really matters. This is a core thing which really determines how well you are trained and the type of and the amount of opportunities you are getting in the process. So you raised very important points, and I don't have any question actually, so you can proceed to the next points.
Okay. So the next thing that I think is important, that I don't put under the program, I usually think about it as a hospital thing, is the pathology that you're going to be able to see there. Does the hospital have strong pathology? Is there, what kinds of illnesses are they treating? Are they really treating sick people? I mean, that's really what you want, and a diversity of diseases. You want to make sure that the patient care volumes are strong, but not excessive. Again, very difficult to really understand. Asking residents how many patients are typically on your service can be helpful. I mean, if they say, well, we're capped at 15 or we're capped at something like that, that's probably a reasonable amount. When they say, well, you know, sometimes we have as many as 20 patients, 24 patients on our service, depending on the complement of residents on that service, that's probably a warning sign to me about the numbers. So understanding the configuration and how many patients are on the services, you know, it tells you more than anything else. I just want to know that you have sufficient volume. And usually that's not a problem in programs, the volume issue, sufficient. Usually it's an excess thing rather than sufficiency. Availability of in-house fellowships, I mentioned that already, but for some people that becomes very important. But here's the thing, don't believe that just because there's in-house fellowships that you're going to be able to get those in-house fellowships. Because they do draw people in with those fellowships, believing that if I do a fantastic job as an intern and I want to be a cardiologist, I'm going to get that fellowship. And you know, you might, but you're also going to have a whole bunch of other contenders from your program. And the program is not just going to want to bring people from their program, because they become less attractive to other people when they do that. So the presence of a fellowship is a good thing, but you cannot look at that as something that guarantees you're being able to do a fellowship at that institution. So just recognize that. I always put, you know, and I guess it's not a popular thing right now, but looking at the diversity in the program, looking at the cultural, racial, ethnic, gender diversity, to me becomes very important. Because, you know, when you have a variety of individuals in your program, there tends to be more cohesion. If you have too many just of one group, and you're not a member of that group, you tend to feel isolated. So, you know, I think when I see programs that sort of have this rainbow and people from all over, I feel like those are healthy programs, but that is my own perspective. But I would look at the diversity within your program as one other thing to ask yourself: do I feel like I would fit into this program? It's not an inconsequential question, for sure.
That's actually a very interesting point, by the way, Dr. Parker. It really matters, because you happen to be a minority. Like, you know, if a certain group is dominating, then, like, you know, you'll be treated as minority. Definitely you will be feeling isolated, like we said. And that really matters, especially during intern year. That really matters. Once you become a senior resident, obviously, I mean, you have already survived it. And then most probably you will be you will start feeling comfortable after that. But intern year is the most grueling year, and at that time you shouldn't be, like, you know, feeling this having this feeling of, you know, isolation and all that. So that really matters, and we have to look into that one seriously, I guess. Thank you,
Right.
Dr. Parker, for raising that.
I had a situation in my program where one year I had more than 50%, or maybe 50% of the residents were Ethiopians. It was a lot of Ethiopians. And some of the other residents came and they said, you know, they're speaking Amharic, you know, in the noon conference. We feel isolated. And I had to tell them, look, you know, I am all about speaking your own language, but not here with other people, because it is alienating for people. Nobody usually intends for it to be, but it feels that way. So anyway, that's probably not a usual situation, but that was my situation. They complained about the Amharic.
We were 7 out of 13, by the way.
What?
We were 7 of us amongst 13 of the interns in my batch. We got lucky. I don't know how that happened. Like, you know, everybody wanted to come to Aurora, so we ended up matching, being 7 out of 13. So we were the majority, super majority actually, because like 6 of them were from different places. So, like you said, other people may get intimidated, obviously. So if I was, like, you know, the one amongst other people, definitely I will feel intimidated, especially if they are not speaking English and all that. So you feel isolated. So that matters.
Yeah. And I've even heard, well, I don't know, I don't have any knowledge whether it's true or not, but I have heard that there were, for instance, programs that were pre-match programs, that they were intentional about saying we're only going to allow 3 of this and 3 of that and 3 of another, like when they actually selected their individuals to try to mitigate that kind of a problem. Don't know if it's true or not, but there was talk on the street about certain programs behaving like that, which, you know, I'm not sure that that's not really the right way to go about it either, but I think some people do. Okay, some other data to just think about, and that's sort of post residency data about graduate fellowship placement. And I don't mean to keep harboring on fellowship placement, because there are lots of people who won't do fellowships, but there are a lot of people who do fellowships. So paying attention to that is important. Paying attention to how they present that data, because sometimes they just put a list of fellowships on there. You have no idea if it's residents have graduated in the last 10 years or in the last 2 years. You really don't know. You're never going to know the data completely, because they're never going to tell you this percentage of our residents applied for fellowship and this percentage got fellowship. You won't ever know that data. Okay. I mean, they might tell you, but unlikely, unless they have 100% match rate, which they could, depending on what fellowships people go to. But if you see lots of fellowships, like I held someone the other day, and the institution just gave a list. I had no idea how many years it represented. And many of the fellowships were fellowships that were not difficult to get, not at least now. And so if you see a lot of people who are going into renal fellowships or infectious disease fellowships, those are not hard to get right now. And you cannot use that as, you can't translate into pulmonary critical care, hematology, oncology, cardiology. You really can't. So I think it can be misleading for people if they don't exactly know how many of the graduates went to fellowship, over what period of time, and if you don't see some competitive placements, or at least placements in competitive subspecialties on that list. It may influence you. If you absolutely strongly know that you want to do fellowship, then really the name of the game is picking institutions where you feel like you're going to have the best chance of that, of success in that area in the end, whereas, and nothing of course is guaranteed, but I would just emphasize that for those of you who may know that you really want to do that. Board pass rates for the residency programs are all available online. You just have to type in ABIM. Well, I should say they're available for internal medicine, they're available for pediatrics, they're available for family medicine, not available for surgery, not available for orthopedics and some other things, but for those 3 specialties, and there may be some other ones, you can find out what the board pass rates were from your institution. And I think that is worth looking at. The overall board rates or whatever they are, but if your program is significantly deviates from that, there's some pause for concern about what they're doing in academically, or what the clinical teaching is like if people can't pass their boards. Because honestly, the board exam isn't that hard. And if 89% of the country passes it, and your program has a 45% pass rate, I would take that seriously. And there are programs like that in this country. So I would look at that. For instance, if you're in internal medicine is where I, as an internist, and because I deal mostly with internal medicine, which I know the best, but you can find that out for any of them. You just Google it and put residency pass rates, and you'll be able to find it. The last thing was just employment opportunities. It's sort of said that sometimes when you go to an area, you put down roots, I mean, you look at the geography, you look at a variety of things, you put down roots. And then to the best of your ability, if you found that place really acceptable to you, you'd sort of like to know that there might be employment opportunities for you afterwards. And so sometimes that information is somewhat available to you. They may have a list of people that they graduated, that they then employed. They may talk about incentives that they have for their residents. If you join up now, programs, especially in primary care, if anybody's interested in primary care, a lot of programs are offering incentives for you to sign up even after your internship year or at your internship year, and you can get a certain amount of money extra as a stipend every year. It's sort of like you get a sign-on bonus, but instead of getting it when you start your your job at the end of, let's say you finish internal medicine, you get some of that bonus every year of your residency to help you survive. So those are just things to kind of look at, especially if you're thinking that that might be an area where you'd want to practice, particularly if you're interested in primary care.
I think those are really valid points. And the other thing is the tendency is that most people tend to stay where they get trained, right? So if you train in Atlanta, chances are highly likely you may stay in Atlanta. So for example, you see me, so I'm in Midwest, I stayed in Midwest. So chances are very high, even though when I came here, my thought was like, I would go back to DMV, but it didn't happen, you know what I mean? So the majority of the time, you have to know that, like, if you go to a certain area, chances are highly likely you may stay in that geographic location, at least nearby. Maybe, one area where I haven't seen many people settling down would be New York, I would say, because, like, the cost of living is high, the work is booming and all that. So majority of people who train in New York may relocate to other places. They are forced to do that because they cannot stay there. The pay is not that welcoming and the living expense is too much, and it's a city life, and if you have a family, it may not be family friendly most places, unless, like, you own the Trump Tower. So so I mean, like, you should also think that way, because remember, the chances are highly likely you will stay in that area where you have your training. So you have to think twice.
Yeah.
Speaking from experience, right? I'm speaking from my own experience and from my friends' experience, actually. So most people settle in area where they did their residency.
Yeah, well, that's what I did. I mean, I settled here, and the more roots you put down, the more the less likely it is that you're going to leave. And programs, by the way, one of the reasons that geography becomes important to them when they're looking at you is that they believe if you have a geographic preference, that you're more likely to come there, to places that are in the geographic preference. You're more likely to stay there. And at least with some states, there is additional funding that state may get, state funding, for keeping you and retaining you in their state. Because the country has a physician shortage, and so if they can retain you, they get certain monies. The program, it accrues to the programs. Now, this is not anything that happens all over, but there are, like in Georgia, for years there's been a program for every single primary care resident, peds medicine that stayed in the in Georgia. You didn't have to stay in Atlanta. In Georgia, the program for up to 5 years got about $20,000 per resident. Yes, for the fact that they sort of trained you well, and you liked Georgia, and you stayed in Georgia, and and of course,
that's a lot of money.
Yeah, it is. It actually is a lot of money for the programs, especially, and they had to have a threshold to get the money to begin with, but. Excuse me. Suffice to say, there's some other things that operate surrounding that kind of thing. Okay, I wanted to just talk about, we did talk a little bit about like the culture, the cultural ethnicity and stuff like that. But when I say program culture, I really mean the resident physician well-being. Do they really care about that stuff or not? Every single program now has a whole well-being office, and they offer you this and they offer you that. Some of the programs, I think, really truly are doing everything they can to try to mitigate stress that residents have and try to make things as comfortable as they can. And for other programs, I believe it's like a Chinese menu. They say they do all these things, but it really, from a day-to-day perspective, it doesn't really have any meaning for the residents. If it's a toxic work environment, even if they offer you a free gym membership, if you can't go to the gym, it doesn't really matter if they offer it. So I don't know how one really assesses this, because I think the program culture is very, very difficult for everybody to assess, and maybe one of the most important things of a program, but it's difficult to assess if you don't have any inside information. But there's still, I think there's still ways that you can kind of figure certain things out. Again, you go to those. You ask questions, you go to they allow you to talk to the residents. You can ask additional questions of them after your interview is over if you have some other questions. You make sure that they don't have excessive numbers of patients on the service, that they deal with some issues related to work compression, that the program director, honestly, from what the residents tell you, really cares about their residents. And most program directors do, but not all have the same particular focus on that. Okay, so that's really program culture. And then the next group of things is this program fit, which I think starts out with, do you want to be in an urban setting? Do you want to be in a suburban setting or a rural setting? Does it matter to you? I mean, for a lot of people, it really would matter. They don't feel comfortable in an urban setting, or they don't feel comfortable in a rural setting. I mean, there are many people I know on your application you put down, I would love to be anywhere in the world, because you don't want to somehow limit yourself. And that's what I tell people. But when you're assessing where you want to be, it can matter and it should matter. And you should know what environment you feel comfortable in. If you think that a small rural area is just too limiting for you, then you have to be honest about that, because there will be a lot less things. Of course, a rural area may be safe. There may be nice schools. There may be beautiful parks. There may be all sorts of other things that you're going to have a harder time finding in a city. So, there are major differences between cities and rural and suburban areas. Housing options, cost of living, transportation that's needed. Those are things that, I had somebody who did a cost of living assessment and put that down on their list. I think it's important. I don't know that it's the be all and end all. Some of the salaries are adjusted for areas of the country, but I think it's been pointed out, if you're living in New York on a resident salary, even if it's higher than what it is in Alabama, let's say, you don't make as much money in Alabama, it's probably the case that the cost of living is so much lower in Alabama that your lifestyle is going to be better in Alabama. You're going to be able to afford more things. But I want you to think about it as a finite period of time too. It's a short period of time. And so, it's not like you're going to save tons of money as a resident, or, you're not going to make enough to save and all this kind of stuff. So, you do have to, though, have some relative understanding, I think, of the cost of living and the apartments. Where would you live if you went to this program? Where do the majority of people live? What are the options available to you? Transportation, that's important because some people don't drive. I have lots of residents who didn't drive, and now they're thrust in, and now they've matched in Buffalo, New York, that has snow, 3 feet high for 5 months out of the year. And they're like, whoops, didn't know that. So, again, these are things that you don't want to add on to your anxiety with residency. So know a little bit about what your transportation would have to be. And if you are going to need to know how to drive, then realize you're going to have to buy a car. There are going to be additional expenses that are going to accrue to you that you have to figure out in advance, if you get matched in that program, how you're going to deal with that. And those may not be insignificant to you. Employment. I put that down on my list. I'm looking at my list that I have, because I think if you come with a partner, if you come with a spouse, if you come with a family, and if that individual is employed or works or wants to work, you really do have to consider what the opportunities are. If all they do, if all their work is virtual, it may not matter, but it may matter a lot if they're looking for other types of jobs. So, if you come as a unit, and hopefully if you come as a unit, you come as a happy unit. We don't want you to become an unhappy unit during your residency. So I would just suggest that you don't discount the needs of your partner, spouse, and family in this whole thing, because it becomes extremely important to a lot of people, as it should. Insurance benefits, stipends, most people don't pay any attention to any of this stuff. Personal leave, they're just like, it's all the same. It's really not all the same. But I don't expect people to really pay much attention to it unless you have some particular needs in your family. Let's say you have a child that has disabilities, then you really do need to make sure that, you know, you have certain things that might be written into your contract, or that you have good medical coverage and stuff like that, and that you don't have excessive, you know, you're not going to accrue excessive costs. But those are things that probably don't affect most of you. Climate, you know, climate is climate, but I don't know what to say about climate these days because the climate is all upside down. But obviously it's different living in a temperate climate as opposed to a place that's really cold. And I've known individuals who won't even look at cold places if they come from warm, temperate climates. But just be aware. I don't think it's something that really should strongly influence you, but it might. Demographics of the patient population. If you don't speak Spanish, let's say, and I'm just picking Spanish, and you go to let's say you go to Miami or you go to El Paso, Texas, and 40%, 50% of the population you're going to treat is Spanish speaking, and many of them are not going to speak English. That is going to impact your residency training. It's going to impact you, and please don't take this as any kind of discriminatory comment. But it is going to mean that you're going to need translators. It is going to mean that your relationship and the way that you handle things is going to be different. So I would just think about that. If the predominant language is something other than English, some of you are going to have enough struggles in a way to make sure that, you know, your communication in English is easy for you, and it's going to get better over time with patients. But having individuals from another who speak only another language and having a significant portion of your patients speaking only that language is going to test you during your, you know what it's like to do an interview when you have to use a translator. It takes a lot of time. And it's never quite as satisfying in a way. At least that's how I looked at it. The last two things on my list are under program fit, is the quality of the schools if you have children. So don't discount that. If you have children that you're bringing to this country, or you are here and you have children, you should look at the schools that are going to be available to you, because it matters. It matters where those schools are in relationship to where the program is located. So if they're, you know, and everything in this country, there's a rating system. You can look at if the school's a 10, if it's a 2, you know, the elementary schools, the public, all the public schools, there's, you know, greatschools.com or something. You know, it's not perfect either, but it gives you a sense of the resources, how happy people are with those schools. And I think it does become important. Some of you may want to put your children in religious schools, and that's a whole other thing, because if you're in a rural area, it's very unlikely that you're going to have a religious school that's available to you, or any kind of religious training. So just consider that. And then lastly, and again, this list is not ordered in any way in terms of importance, but is the religious and cultural aspects of your life, and whether or not those things are going to be available to you. If it's really important to you, then you should consider it, because for 3 years, not having a place to worship, if that's something that's really vital for you, is going to be a problem for you. Or it may be a problem not so much for you, but for your family. So I think those are things that, for some individuals, may trump a lot of other things in terms of how they rank things. And again, this is where the personalization comes in, that you have to consider these things in terms of how important it is to you. And it's sort of like, be true to yourself, be true to what's important for you, but also recognize when you're looking at this, that it is a temporary stop along the highway of your professional career. And these things aren't necessarily going to be forever. So those would be the comments that I would make in regards to program fit, especially when you're moving here with a family, that you need to consider. The other thing actually I wanted to mention is safety. I get a lot of things like this. Oh, but it's so unsafe there. I'm like, really? So if you are looking at programs in Chicago and you Google Chicago, you're going to find that, you know, Chicago probably doesn't have a great safety record. If you look at Atlanta Atlanta has a high crime rate, but most of the crime does not occur where you're going to be a resident. So it's really not going to impact you. So I would just say that if you have concern, I had people say, I'm not moving to Brooklyn. Brooklyn's a nightmare. I'm not going to go to the Bronx. And I'm like, really? You know what? It's really not what you think it is. It may not be like, some rural community where you can walk at night and, and whatever, stroll along the streets and not worry about things. But it really depends. You may not be living right around the hospital area. You're going to be living outside of that area. So don't discount things thinking that somehow you've heard horror stories or you've seen some movie about a gang in the Bronx and you're going to discount that program that might otherwise be very good. I would really ask you to do that. And I know that's hard.
I think you have raised a very comprehensive list of things to be considered, to be honest. And I mean, whoever is listening to this conversation, you need to really pay attention, because these things may seem minor things, but they do really matter, because they are going to affect you one way or another. It may affect you, it may affect your children, it may affect your family if you have family moving with you guys. So pay attention, because let me give a simple example, like from my personal experience. So coming here to Milwaukee, I never knew Milwaukee was like, snowing like hell. So the day of my interview was supposed to be on Monday, and I was flying from Amarillo. I had another interview in Amarillo. So I came straight from Texas, and Texas, I didn't need any overcoat. I was enjoying the weather there. So I just flew from Dallas, came to Milwaukee, arrived around midnight, and my best friend was supposed to pick me up from the airport. Then when I land, I got a text from him. It was midnight. It says, "Hi, Fike, I couldn't come to the airport because we have a snowstorm. I cannot drive. Please try to come with Uber." Boom. I was surprised. It was a big surprise to me. I was an idiot at that time. I didn't even know where I was coming. I should have really explored the weather and everything. But most of us, we don't have that experience. So I was just moving randomly. So then I had to wait for more than 30 minutes or so to get an Uber. Then the Uber came. We can barely really see from the car because it was heavily snowing. So we got stuck. I arrived here Friday night until Monday, where I came for the interview to the hospital. We didn't even get the chance to get out of my friend's house. So then, I was thinking day and night, am I coming here? You know what I mean? So because I wanted to come here because I loved the program, my friends were here, and I knew that I probably would rank Aurora number one. But I started questioning that decision. Am I signing up for this for the next 3 years? Can I handle this? It was a big, big, big decision for me to make, actually. Until the last minute, I struggled whether I had to put Aurora number one or not. So it seems simple, it seems straightforward. Now you may think, why should I care about weather? What I care is about residency spot. I know that's your primary goal, to end up matching, but at the same time, if you have the opportunity and the choice, you have to be seriously considering these things into consideration. So I really encourage you, those of you who joined us late, I encourage you to go back and watch this video, or watch the video shared by Dr. Parker in her LinkedIn page. It's very comprehensive, it's very thoughtful, it's very detailed, evidence-based. You'll never get this kind of information from anywhere else. So thank you again, Dr. Parker, for doing this and for joining me again as well. So I think we can raise a couple of points and we can start finalizing our discussion. So you can talk about how people should process the communications they had with program directors, the post-interview communications they made, letter of intent, the responses they get, and things like that in the decision-making process while they're finalizing the list. So if you can say a couple of words about that would be great, Dr. Parker. Thank you again.
Sure. So one of the things that we know very, very strongly, and it's been the same data for the last couple years in the program director survey, is when the program directors are asked, what do they really look for in the applicants? What are some of the most important things that they use in terms of their ranking decision? It is the interview. It is how you came across in the interview. Again, your perception about how you came across may not be accurate. But they do look at how you interviewed with them, how you interviewed with the faculty, if the house staff interacted with you, what kind of interactions did they have? Did they have an impression of you that they gave to the program directors? So I would say all those kinds of interpersonal things become important. The post-interview communication issues are it's not really clear about post communication issues. There's a few things that are starting to creep in there in terms of post interview experience. And what we do know is that a lot of people do write programs. They do write programs and convey their interest in a program. We know that a lot of program directors don't take that very seriously because there's so many people who lie and tell them that they're the first choice. And so there's many programs who don't look at that data at all. I mean, they just don't even entertain it. And some of you have had programs where they'll say, don't send us that. We don't want you to send it. And then, hopefully you listened to them and didn't do that. So I think that it's very hard to know how much letters of intent really matter for program directors. For some programs, there is some evidence that it changes things and that they may move you up or down on the rank list based on your letter of intent. But there's one study that's from about less than 10, it's 10, already almost 10 years old. It suggests that only about 5% of program directors really said that they changed a person's rank order list position depending on post-interview letter of intent or other types of communication. 5.2%, not a great amount. There was one recent article, interestingly, in Chest that had to do with fellowships and not with residencies, but in fellowships that said about 17% of fellowship directors actually were influenced in terms of your rank list if you wrote them and told them of your commitment to the program. So that's kind of different. I mean, that's more than 3 times what this other study did with program directors. So the answer is I think that in some cases it can have some kind of an impact. I think at large programs, university programs, they make a very intentional decision not to look at that data. For some other programs, especially new programs, it may mean more to them, but you don't know. I still advise people to do it, but recognize that it may make absolutely no difference in many programs. One thing's for sure, if you have sent post-interview communication to them, then hopefully it is actually not generic and is honest and is straightforward and really indicates why you think that program is a great fit for you, why you picked that program, and how you feel like you can add value to their program. So that would be post-interview communication. And then there is still program directors who will look at individuals' geographic preferences. Those still are important. They're important when people select individuals for interviews, but they're also important when they rank people. Because why? Just as we've talked about, they want to know that if they put you high on your rank list, that you're likely to come there because it was within your geographic area of interest. So 40% of program directors said that was important, and they rated it as a 4 on a scale of 4 to 5. Whether you gave them a signal was still important to some program directors in the ranking process, but post-interview contact and the least important thing was second interviews and visits and how much that mattered. Again, still, when people are invited to some kind of secondary interviews, I still tell them if you can go, if they're virtual, certainly go. If they're interviews, if you're already in this country and you can go to them, you should. But don't believe that they're going to make a great deal of difference. At best, what they're going to show is that you have interest in their program. I think that in the really end of this, what I would say is that you really have to realize that you're never going to know everything about a program. So your data is going to be incomplete, right? You're going to have to sit with some uncertainty. You're going to try to craft a strategy that you think is personalized and reflects your needs. You're not going to let your mom tell you what to do, or you'll fight it out with your spouse maybe, but hopefully you can have a nice a conversation talking about things. I do think it helps to put things on a spreadsheet, but understand that giving things point values and all this kind of thing probably is a little OCD, and I don't know that necessarily it ends up with the best decision. Please make sure you order your rank list in terms of your preferences. If anybody's catching this at the end and didn't hear the beginning, you really don't just disregard what you think how you think the programs are going to rank you. Make sure that you certify your list before the deadline. When you when you go in, I didn't say this, but when you go in and you order your rank list, you have to save it and then you certify it, right? And then if you decide you want to change it, which you can do before the certification date, you can do that. But when you go back in, it is now no longer saved and it's no longer certified. So if you go back in, you have to save it again and you have to certify it again. It will not remember and say, oh, you certified it a week ago. We'll use the certification that you gave us last week. No. And I used to actually have nightmares about this when I was a program director, because after I certified, they send you an email, right, saying your list is certified. Don't touch it. Don't go back into it. Once you've certified it and you're happy with it, don't create any doubt that maybe you've saved it but not certified it. Okay. Make sure that by the 5th of March, and I would encourage you to do that before the 5th of March, don't wait till the last minute, that your list is absolutely certified. And then really at the end of all this, just congratulate yourself for getting through it. I'm sure that if you go through it in a really, in a detailed fashion, you will make the decision that's best for you. And, and if you choose A and not B, you'll never know what your life could have been like at another program. It may have been worse, it may have been better, but actually those things are really not even important. Once you make your decision and hopefully all of you match, that's what becomes important. It's like the next step on your journey.
That's very beautiful and very thoughtful advice, Dr. Parker. So because Dr. Parker, as you know, guys, has been a program director for more than 25 years in internal medicine. So she has ample experience, more than enough experience actually. And she has worked with many residents and all that. So she has seen many struggles amongst the residents and things like that. So it's a very valuable advice, and I would like you to take it seriously. And those of you who has missed it, like I said, there is a video, very comprehensive video, which is shared in Dr. Parker's LinkedIn page. You can go watch it. There is also a PPT, a PowerPoint presentation alongside her presentation, an audio presentation. So you can watch that one for detailed understanding, or you can come back and see the recording of our discussion from today. I mean, I wish, Dr. Parker, you gave us this kind of guidance by the time I applied. Probably I would have made better choices, or even you never know, because things might have changed, in terms of my decisions. Many things might have changed. You never know, because guidance is very important. That's why we need people like you. That's the reason why we need mentors and all that. So Dr. Parker would be working with candidates next year. Those of you who didn't make it this year for one reason or another, or those of you who are on the way preparing for the 2026 match, I encourage you to sign up with Dr. Parker at the earliest possible time. By the way, don't assume I am advertising her services. Actually, I am advising you and encouraging you to get her guidance, because it's a game changer. I didn't have this opportunity. I didn't have this luxury a couple of years ago. I wish I had it, because, like I said, there could have been many changes in my decision. So I would encourage you to sign up early. Sign up early. Don't wait until the last minute and scramble, because last year my experience, and Dr. Parker's experience was like, after your slot and availability was fully booked, People were sending private message, please talk to Dr. Parker, get me signed up, blah blah. So that this year, now you know, and we will share her success stories and all that, because I am sure many of our candidates would be matching this year. Fingers crossed. I'm hopeful. So we will have other sessions where we will be introducing her new services, how the service will be organized, the time availability, from which part of the year will she be available for candidates and things like that. More information will come up. And I encourage you to sign up. Those of you who are planning to sign up next year, for next year, 2026, that means. So those of you who are applying this year, listen to this conversation again and again, make informed decision. And the other thing is, certify it at the earliest possible time. Don't be waiting until the last minute. Certify it, sit on it, think about it. If you want to join, to change, make informed decision again, go back, change it, certify it the same day. Don't save and go, and then by the time you wake up, already the deadline has passed and you haven't certified, and there is no way you will be entertained. Once you miss the deadline, you miss the deadline. So these are some of the things I would like to say. So Dr. Parker, there are one or two questions, if you would like to highlight on that, then we can finalize. So Ebenezer says, is it true that advanced programs look for prelim spots for partially matched candidates who match with them? So, for example, if you match for dermatology and you don't get a spot for a transitional year, does the program assist you? I think that's the question he wants to ask.
I mean, that has been my impression with many places, because most of these advanced programs are in university settings. And so many times sometimes they actually hold spots, but oftentimes they do. But I can't tell you that that's, that's 100% that would be the case. But yes, I've seen that many times, that they've assisted people. So of course it's still helpful to be in the SOAP. I've seen people who didn't get they got an advanced spot, they didn't get their prelim, and they went into the SOAP and applied for every single prelim, whatever was out there, and they got something through the SOAP. So that would be what I would say about that. Is it okay to write letters of intent to programs we ranked second or third? Say, yeah, you can do that. And I think that's fair if it's your second or third to say that you rank them highly. Again, it needs to be a genuine letter that indicates why you rank them highly. I think, and you don't need to go on and on and on and on, but give them some idea. They'll get it. If someone also wrote, the PD said they don't want post-interview communication.
It looks like we are disconnected.
With me? I can hear you.
You can hear me? Okay, you are back now. So you were kind of paused. So you can go ahead.
Oh, what I was going to say, did you hear the stuff? I think you heard the stuff about the advanced places and the prelim. So,
yes.
But if it's your second or third choice, yeah, you can write them a letter of intent. If the program director says, we don't want post-interview communication, don't write it. It's sort of like, if somebody tells you not to do something, why do you want to? It doesn't leave the program director with a good impression of you, sort of that you're obstinate and you're trying to exert your will in a way that isn't welcome. So don't do it. And in any event, if it doesn't hurt you, it's just a waste of your time.
Yeah, I mean, respecting whatever instructions you are given is also one of the qualities. Otherwise, you will be annoying the program director. And they would say, if this guy is so annoying before he joins me, then how am I going to deal with him or with her for the next 3 years? That's the kind of information you are passing along. So if they tell you not to do it, don't do it. Some people say, they say, no, we don't need any thank you letter. Even thank you letters, some program directors, they don't want to see that. Because they know the majority of the thank you letter is just a generic letter, and it doesn't mean anything. If honestly, if you think about it, it doesn't mean anything, right? So everybody wants to say thank you because we all are anxious that we may end up not matching. So we may say whatever is possible, like to convince the programs to take us into their program. So I mean, they may not want you to write thank you letters or letter of intent, but if they didn't say anything, you can go ahead and do it. It doesn't harm, at least, right? So I think
it's not going to hurt the thank you letters. But again, if they say nothing that they don't want anything, then I wouldn't give them anything. And again, if you write a letter, don't say, I think that you have a great educational program with a 4+2 and blah, blah, blah. And it's just a few things that you took directly from the website. I would believe that if they really are going to read it, they're going to want to see that you can convince them of what is exceptional about you and why you would be a good fit for their outstanding program. But just listing some of the attributes of their program, it sounds, you can read right through it.
Yes, it has to be generic as much as possible, right? So, based on your experience during the interview day, you can mention from the conversation you had, and then you can tell something based on the virtual tour you had. You can talk about the amenities and the things which you observed, actually, not something which you copy pasted from the website or from whatever resources they shared with you. So it has to be authentic, it has to be generic, it has to be unique to your experience. So if at all you have to write a letter of intent or thank you letter. Dr. Parker, it's always a pleasure to have you around. If you want to say something about some of the changes you have made in the website, take the floor and just introduce, at least for those people who are new, or even those of you who worked with Dr. Parker this year, or even if you haven't worked with her, I am 100% sure you would have colleagues and juniors and friends who are in the process, so you can introduce about the existence of this service. Everybody knows the existence of the service, but you can really encourage them to look into it and consider it ahead of time. So you can tell us something about the changes, the updates you have done on the website and all that. Obviously, we'll have another session. That's why I didn't really.
Well, so thank you. I wanted to say, just thought of two other things I wanted to say. I recognize that everybody is hoping that they're going to match, but we know that everybody won't match. And I always tell people it is better to be proactive. So once you put in your list, I want you to start thinking about soap. Now, soap is one of those things that is only 5% of people match with soap. Okay, so it's extraordinarily difficult to get a match with soap. So you have to recognize that. But if you do end up deciding to use soap, and you should, if you don't match, you should enter soap, even if it's unlikely that you're going to get something, depending on what specialty, if you're in internal medicine or family medicine or whatever, you should try. But it's important that since you can't change your application, you can change your personal statement. You can potentially get a different letter if there's something that you think, somebody that you could get a better letter for, or a different letter, or there's something that you've done in the last, since you initially applied that you think would serve you better. And so you should already be thinking about that, is what could I do if I ended up not matching and having to soap? What could I do to put forth the best soap application that I could? So I know it's not popular to think about, but I really believe that this is a long game for a lot of people, right? I mean, it may not happen the first time round, and you have to be realistic in terms of chances and being ready, and to go to the next part if that's what happens. I can't tell you enough about how important I think it is. I mean, grieve the fact that you didn't get a spot, but then you have to be able to turn around immediately and go through this process. So if you've already thought about it in advance and thought about what you might do if you have opportunities in any way to make your application stronger or a little bit different for the SOAP, I would encourage you to spend some time making that consideration, because you'll be really glad that you did that if the event that you didn't match. Okay. All right. So
since you mentioned about SOAP, some people may not even be familiar what SOAP is. So it happens on Monday afternoon, right? So right after the match is announced, if you don't match, then they will send you the list of programs which are not filled. So then that will give you an opportunity to look into the list and apply to those programs and reach out to those programs. Like Dr. Parker said, it's very competitive. You have a very short time window. and you have to really reach out to the program and get a hold of them, those unfilled programs. If you match, then you don't have access to those unmatched program lists and all that. So programs would also get list of unmatched candidates. So you have to convince yourself. And now, all what we said is going to be messed up now, because you might have decided not to come to Midwest, and then those programs which are not filled, maybe in Midwest where there is snow and all that. So you have to make that decision, and you have to be prepared ahead of the game. So I think that you brought up a very important point about SOP, and we have to be hopeful for the best, but we have to also be prepared for the worst. The worst being not matching, which can happen to some individuals. So, Dr. Parker, thank you so much again. It's a pleasure always to have you around. So, say something about, like, the new arrangements in your website, and then we can conclude. You can also say a few words, closing remarks together.
Sure. So I have been operating under IMG specialists since I started doing this, career coaching, application coaching, and as of I opened another business. It's really mostly a name change. I wanted to make it more accessible to people, easier to find me. And so I've rebranded myself under My Application Coach. So if you are looking for my services, you would go to myapplicationcoach.com. You'll see that in all the videos now. It actually is my YouTube channel, has always been My Application Coach. And so this was just kind of making sure that all the branding was consistent. It's been a labor of love to get that website up and running. I hope that you'll take a look at it. There's more offerings that I didn't have before. I started to coach medical students that were looking for opportunities to get into medical school this year in the United States. And so I wanted to make sure that when they saw My Application Coach, when they saw IMG specialist, they sort of wondered whether there was a place for them. So I felt like this was a more inclusive, easy to remember title for us to use. So I have tried very intentionally. I had all my reviews from IMG specialists brought over to My Application Coach so that you can read all the reviews there that, are from the last, year and a half or so. You can look at the match results, some of the match results from last year, and see, individuals who used my services, what their thoughts were about my services. I am going to be using it to upload videos, to upload various blogs. There will be more content on that, and also documents that you can download. There are right now, when you go to the website, you go under residency and fellowship, there actually are some packages, and there is an early bird package for those of you who are willing in the next month or two to start working on your personal statement and your ERIS application to get that done early. If there are any changes that we have to deal with, we'll deal with them. If ERIS introduces any new changes to the application and we have to get together and address some of those things, we will. But this would assure you that you would have those things completed by July and that you wouldn't have to worry about all of that. And it is true, I got inundated, people who were calling me at the end of August, even September, wanting reviews, and I didn't have the space to be able to do it. I wish that I had, but I had to turn people away. So I'm hoping that I'll have a cohort of individuals who will get better pricing and will join me early, and will feel a lot of relief, I think, to get that out of the way early on and not have to worry about that. Because honestly, the reason a lot of people put things off is because they procrastinate, they don't know how to begin, they say it's too hard, and then they find themselves really having difficulty in the end. So I hope to see you all on my site. I look forward to anybody who has used the previous site. I would love to hear your comments and navigation and all that, how you feel, your thoughts about the new site, and hope to see you there. And thank you again for having me as a guest on your show.
No, I mean, it's my pleasure, and it's an honor for me actually to have you sit with me for about an hour and a half, and to learn all this valuable lifetime experience of yours. So I really appreciate you. under my name, as well as like those people who are watching from different places. So I wish everyone applying for 2025 good luck, and obviously there will be a time to celebrate our successes after the match is announced. If something comes up and we have to come back again with another discussion topic, we'll announce, but my guess would be probably we'll do it after the match is announced. And then obviously we'll continue working on different topics along the way, even for the upcoming 2026 application and all that. So I hope Dr. Parker will make some time to sit with us again to guide people. We do not have to do what we did last year, but new questions, new perspectives, new thoughts can be shared in the months ahead of us. Thank you, Dr. Parker. I really appreciate you, like every time. So may God bless you. Thank you, and have a blessed day. Enjoy the rest of your day.
You too.
All right. Thank you. All right. So, I mean, I believe we had a very beautiful discussion. It was really an honor for me to have Dr. Parker with me all the time. So, I mean, you guys are fortunate to have this opportunity to get this first-hand information from a highly experienced person like Dr. Parker, because she has a very rich experience as a program director. So, this is a first-hand information. So if you are informed, information is a power. So if you are well informed, then you make an informed decision, and you wouldn't regret it. So make use of it. If you have missed it, go back and watch the whole session. It will be here. It will be in my YouTube platform as well. And those of you who didn't get the opportunity to look into her presentation, which is shared in her LinkedIn page, go back again and watch the whole audio there. It's a very interesting discussion. You will love it. You will appreciate it. እና ይህን ይመስላል ኢትዮጵያውያን። እንግዲህ ያው እግዚአብሔር ይርዳችሁ። ከአሁኑ በተባለው መሰረት አስቀድማችሁ ተዘጋጁ። በተባለው መሰረት ራንክ ኦርደራችሁን አዘጋጁ። ያው ተመካከሩ፣ ከቤተሰብ ጋር ተመካከሩ፣ ራሳችሁን አማክሩ። ፕላስ ደግሞ ጸልዩበት። አንዳንድ ጊዜ prayer is a key, so pray about it. So make your list. እግዚአብሔር ወደ ፈቀደ ቦታ ነው የምትሄዱት። እህልዋ ወዳለበት ቦታ ነው። what is meant for you will just happen. So wherever you go, it's for the best. Wherever you are heading, ለጥሩ ነገር ስለሆነ ለ3 ዓመት ነው። ቻሌንጅ ያለበት አካባቢም ቢሆን ላይፍ አሁን ኤክስፔንሲቭ፣ ስራው በዛ ያለ፣ ጫናው በዛ ያለ እንደ ኒውዮርክ ምናምን ቢሆንም who cares? ሄዳችሁ እዛ 3 ዓመት ተምራችሁ ሙቭ ኦን። እና ዋናው ነገር ግን እድሉና ምርጫው ያላችሁ ሰዎች አስተውላችሁ እንድትመርጡ ነው የዛሬው ሴሽን። የተወሰነ ሊሚትድ ኦፖርቹኒቲ ያላችሁ ሰዎች ደግሞ በቃ ፎከስ ኦን ዋት ዩ ሃቭ። ያላችሁን እግዚአብሔር ይጨመርበት። ሁላችሁም ሰክሰስፉሊ ማች ታደርጋላችሁ ብዬ ተስፋ አደርጋለሁ። እግዚአብሔር ይርዳችሁ። ከማች በኋላ እንግዲህ we'll celebrate your successes. Thank you so much for joining us. It was a big opportunity to sit with you guys. Now, good luck, everyone. Have a beautiful day. Bye-bye.